Okay. So we're recording. Okay, so I'm using first. I'm gonna try. You have pain right now where?
And for migraines and my lower back down
Okay.
here.
On a scale of 1 to 10, what's your pain level? Say for your migraine first. 10's the worst.
It
1's
ranges
good.
right now. It's about like 5, 6, 7-ish. But like,
Is it that much pain right now?
The medicine. When I don't have medicine, it's a 10. When I'm on the medicine, it ranges from like a 7 to like a 5. So like it helps. So it makes me like can function.
Okay. So right
like
now you have a headache and it's about between a 5 and an 8?
Yeah.
Okay. So first I'm just going to try the pain patches and I'll show you how it works. So Dad, you can watch if you like. I'm going to put it on the pain patch protocol for the headaches so I can teach you how to do this as homework.
What about skin sensitivity, rashes?
If you're sensitive to tape, then we use, this is a non-allergenic adhesive like a Band-Aid. But again, if you're super sensitive, you can put it on your clothing. It works through clothing.
Really?
Yep.
Wow.
I know, it's pretty cool stuff. So that shows patients, one, it's non-transdermal. Nothing's going in your body, okay? So the patches got sealed materials that emit light frequencies into the body that turn on a very specific activation into the body. So put your hands out like this. Let's do it like this. So this is your right hand. So this is the white patch. This is step 1. And then there's step 2. So it works right away. Is your headache still the same? Better, same, worse?
I didn't really notice nothing at the
That's
moment.
fine. Just want to check.
I can kind of like feel it going down a little bit.
Okay, so say, let's just stick to one number. So say it was an 8 out of 10. What number would you rate it now if you could rate it?
5.
Cool,
4.
so we dropped it almost half. So that's pretty cool. So the next point is right here on the wrist. I'm going to move it up here a little bit. Tell me if you feel like
it came back now again. And
yeah. Okay, so tell me
yeah,
at
that
that
went
point,
back down.
is that a better spot than the first one?
The same.
Okay, let's move it to the next position. It's up on the back of the shoulders. And tell me if that feels better, same, or worse.
Yeah, it just went away.
It went away.
Yeah.
Cool. So you said your ankle hurt and your back hurt, correct?
Yeah.
What level of pain was your ankle on a scale of 1 to 10?
It's just kind of sore. It's probably like it's kind of like mild, maybe like a 4 or 5.
Is it any better since we put those on your shoulder?
No.
Okay. How about your lower back? Is it still the same?
Yeah, it still hurts.
Okay. Okay. So let's talk about your lower back. Scale of 1 to 10. 10's the worst. What level of pain is that?
It's kind of like more of an ache. So
An ache? Okay.
Yeah, I don't really know how to describe like how an ache feels.
Yep.
Yeah.
Just there.
Yeah.
An irritation. So I'm gonna put this on the back of your neck right here. And then tell me if that helps your lower back.
It still hurts.
Let's
Yeah.
put it right where you feel it now. Where do you feel it?
It's like kind of like right in the kind of like right
back here.
Yeah.
Okay.
Kind of like in the joint kind of area.
Right in the center or off
Yeah.
to the side?
It's kind of like middle side,
Okay.
like where you put it.
Okay. Have a seat and tell me if that felt like it helped.
Help a little bit.
Okay, cool. So that's the one that's an anti-stress, anti-inflammatory. So now I'm going to try the other one that's a detoxing patch. And then I'm going to try the new one and see if that does something different. It's not as dramatic.
It still hurts, but like it's gone down a little bit.
Good. Okay, that's good. So I'm going to apply this one on top of that one now. So turn around. I'm going to put this right over the top of it. Tell me if it helped it get even better, same, or worse.
I can still like feel it like slightly when I'm like moving.
But it got better.
Yeah.
So that tells me the body has toxic buildup, and it's starting to remove that and the inflammatory response as well. So 2 things are happening in that area.
What toxic would it be?
It could be pollutions in the air, it could be exhaust fumes, it could be in the foods, it could be in the paint, in the carpet. It's a combination of everything that you're just exposed to over your whole life. And eventually it builds and builds, and then there's a tipping point that happens, and then all of a sudden you have symptoms. Like the migraine, boom. Where did it come from? Why did it finally hit now? Why didn't it wait till you're 40 or 50? It's like eventually the glass becomes full. And once the glass is full, the water starts overflowing, and that's the symptoms. So these start to get things checked and cleared out, and then eventually the symptoms subside, and then it starts to go and eat away into the problem, which is the cause, not the effect. Okay?
Do they work better if you have them on your skin directly?
Well, no, actually, they work 3 to 6 inches off your body, the exact same effect. But once we isolate the pattern and the placement that give you the best relief, then we take the bags off and put on the skin for a 24-hour treatment. Okay. So, how's your
That's pretty
ankle? How's your back? Tell me what's going on.
Ankle still hurts.
What's the pain level in your ankle?
It's like the same ache. It's a little bit more severe than my back.
Okay. Does it hurt if you stood on it worse or?
Usually like it hurts like right now, like when I'm moving it.
Okay. So show me exactly where you feel it on your ankle.
It's kind of like where I broke it. Like right around like where the joint where I broke it, kind of like there.
Yeah. Okay. So try it again. Move it around. And tell me.
It's a little bit less.
A lot less.
Yeah.
Or a little less. Okay. Say what level of pain was it before I put it on? What is it now?
Probably went down a few notches.
Okay. Cool. So how's your lower back or your mid back? Did it help that?
Yeah, that helped a little bit. It's like I can't like I know it's there, but like I'm trying to move. Like my back just popped. Yeah, it's I don't have back pain right now. At
Cool.
the second.
How's your headache? Is that still good?
Slightly there, just slightly.
Just slightly there.
Yeah.
And it was what, an 8 when we started?
Yeah.
That's pretty good. So.
Because I took my medicine. I took it this morning, like at 6.
And then now pretty much wore off basically because you.
Oh yeah, because if you take it every 4 hours, it's needed.
Okay, gotcha. So again, this is not a medication. It's over the counter. It's completely natural, so you can. It doesn't interfere with medications. But it's just a way if you want to do an alternative. But what I've seen it do is actually do healing, not just deal with your headaches and then in 4 hours you do it again. I've seen this stuff kind of go away.
So as we have like
This
like
is
if
what
I have
is
the
really
medicine on top of the patches and like my natural supplements, like maybe all that can, work together and
Heal, not just give you symptom relief.
because like I remember like when you adjusted me, you did like my ankle, you like rubbed it in the spot,
Mhm.
like it went away instantly,
Yeah.
and then
That was the patch. So normally what I do is I do some therapy like that, and if it doesn't get it cleared out, then we have you do it as homework in between visits. So this is kind of why Missy was saying, come back in and let me do this and show you. So then you can buy.
Because I didn't come yesterday, I kind of
That's okay.
forgot.
So you did good. All right. Well, let me turn that off.